this one is driven by what the department requests are, so everything is billed back to the departments. You'll see there was a fairly substantial increase in what our expenses would have been for 2015 and what they are proposed in 2016. A lot of this is driven just on the cost of goods. Things are getting more expensive. The other thing that we're noticing is we're much more dependent on the softwares and maintenance of that is going up. For example, we had to expand servers to deal with all the memory issues that we're having. We're so dependent on data processing now, so we're expanding our servers, and that's 71,000 just that item alone. And so then there's licensing that goes with that, and everything that it gets added on, it's just adding up. And so we're just so heavily dependent on data processing. Sarah and I were talking today. We've got a fairly healthy designated, undesignated fund or unreserved funds. And I do have some questions about that because there's two separate accounts. And so Sarah and hopefully Mel, when the auditors are here, I want to get some clarification on that. The camera project is out there looming. We've got $150,000 budgeted for that. We know it's probably going to cost more than that, so some of that will be taken out of here. Jeff mentioned that they're going to have to update the 911 system, so I know he's setting some money aside, but we could take, the difference out of this account. What I'll do for 2017 is Mike and I will sit down and we'll decide if we can depreciate items longer. That might help to draw this down. So, we'll take some steps to draw that down naturally, so, we don't all of a sudden have a spike because, we didn't budget correctly. So anyway, it's really driven by what departments request for help and what they want for equipment and software. And it's all billed back to them.
Any questions for Deb? All right, thank you, Deb.
Sure.
Okay, land record modernization.
Okay. So this went up just a little bit, $456. And I think I had mentioned when I talked about my budget, we need more help in the GIS area. So my budget went down, and some of this was attached to land records. Land records get state grants. I know that there's been some discussion about, whether we should be using that grant money for ongoing operating expense costs or if it should be saved for projects. But for right now, I have a need, and this is how we're pursuing that. So there's just a very slight increase in that area, and that's mostly due to just more time being allocated to GIS.
Any questions for Deb? Thank you.
Okay. I'll keep going. Property lister. Okay, property lister. So this is a very small amount of time that is charged to Sean Kelly, and then a very even smaller amount of time that's charged to Zach, who's new in my office. And they do the property lister work. And so there is an increase in that area, but it's just Heather was kind enough to reduce one of her staff. They had helped with the property lister work, and so Register of Deeds will no longer do that, and so some of that cost was diverted into this budget. So theirs went down, ours went up a little bit.
Any questions?
You bet.
All right, we are child support.
Hi, Kim.
Okay, my home committee already reduced a few of the areas by $2,500, and I do get reimbursements, so that decreased my levy request initially by $857. The areas of my revenues that are variable because I have to guess during budget time is the medical support incentive, because that can change based on our collections of, birthing expenses, and if someone has health insurance, we can get incentives for that, as well as the child support collections incentive. So based on that, I went on roughly what we had last year. The medical support incentive, since I did my budget, actually, I got more money, this last quarter, so I'm actually up to just shy of 15,000. So that's already bringing me up, which would actually, put me lower than last year, my levy request, so I don't know if you wanna change that. It's just hard for me to guess, that's why I don't know what to put on there, but as of today, I wouldn't need an increase in the levy, so you know.
Which item?
Medical support incentive is one of
Okay,
my
that 10,000?
grants, up
Okay.
above. That's the second one down, and I had 10,000, and like I said, it's almost 15,000 as of today,
Okay.
so, just so you know.
Thank you very much. Pretty well straightforward. The only increases is in the salary and processing, and a few tweaks as far as the expenses. Questions? How's that new safe working? How's that new safe working? Very good. Very. How many years do you think we had the old one? 17 years before, and it was there when Mary was there. Been in the building a long, long time. Wanted a new one, go figure. Okay, no questions? Thank you very much, Elaine. Parks and Solid Waste. Scott.
Hi, folks.
Hi, Scott.
Hello. Parks and solid waste budgets are essentially flat. We've had a small increase in salary and benefits for solid waste, small decrease in all other expenses. Revenues were 0 increase. Parks, we had a small decrease in salary and benefits. All other expenses were flat. So in total, we had in a basically $1.17 million budget, about a $1,500 increase, 0.17%.
Any questions for Scott?
Has the tipping fee remained the same for the collection?
It hasn't. We've got a contract that started about a year ago, and in April of this year, we'll see a small increase, a 2.75% increase. That particular line really drives that budget, obviously, and over the last few years, we've had fairly flat volume increases, so that's how we can make ends meet. That may change. I mean, that's something that we really, I personally can't control.
Any other questions? Thank you.
Thank you.
Basically what it boils down to is the biggest increase are in membership dues and bag. Bottom line up front, although I was able to reduce the budget, 4,600 bucks or so, because of the projected loss of a grant from the state, I still result in a tax levy increase of $6,033, losing about $10,000 in revenue. Larger departments can maybe able to absorb that. That's 6% of my entire budget and about 29% of my operating budget. So I won't have to go into the slideshow unless I'm really on the defense. So.
Bill, are you reasonably sure that that 10,000 is gone?
I'll tell you, right now we're working with WCA, trying to get into the administrative rules process. But after the budget, the state budget passed, chunks of it became law. And the way it's written right now, most of the quote-unquote reimbursements that are going to be allowed are impractical. When it comes to training reimbursement or reimbursement for training, I have to maintain that accreditation to do my job. I can't represent veterans to the VA without that accreditation. They restricted the reimbursements to U.S. Department of Veterans Affairs and Wisconsin Department of Veterans Affairs sponsored training. Neither one of those agencies sponsor training. The training that is required for my accreditation is vetted by the U.S. Department of Veterans Affairs, but the only two agencies that offer that training are the County Veteran Service Officers Association of Wisconsin and the National Association of County Veteran Service Officers. So neither of those would be, and those are the largest chunks of the expense, neither of those would be subject to reimbursement under the current grant structure. The other pieces that they put out were for transportation of veterans to with handicaps with handicaps, basically, unless that transportation is already covered by the Wisconsin Department of Veterans Affairs transportation grant, which it is, which means that piece of the reimbursement is inaccessible. There was also IT. We're trying to figure out what they mean by that. This is an ongoing process. And the last piece of the reimbursement didn't even rise to the level of plausibility. So. Subject to your questions?
Again, I think, WCA passed a resolution unanimously and at the conference, and there again, I think you have to start calling your legislators.
There's a couple of pieces of, if I can put in a little plug. Hub Walsh, he's a county administrator out in Merced, California, started an initiative. Because we do so much of the prep work for the VA and present completed paperwork and well-reasoned claims, do the evidentiary gathering, everything at this level, he proposed that the VA or the federal government actually get up off some funding to help support these efforts at the local levels. That was brought to the National Association of Counties in July. They passed a resolution to try to push for such funding from the federal government. Eau Claire County introduced a resolution shortly after that supporting that effort. WCA latched on to that and is in full support. And next week, when we have our County Veteran Service Officers Association of Wisconsin, I've presented a similar resolution to support NACO and WCA's efforts to gain County Veteran Service Offices federal funding so that we don't get caught in these little political games at the state level.
corrections that I noticed while I was sitting here going through my budget again. After Ruth had talked about no longer filing the civil and small claims fees, the 250 can be taken out of that line item. It is the sixth from the bottom of my budget. That 250 can be removed. Also, somehow $500 in overtime got put in this time, and we do not have overtime. Any extra hours that the staff works, we comp it and flex it out, so there wouldn't be any overtime. It's the third line under the first, under salaries. There's salaries, unemployment comp payment, and overtime. In ringing true with everyone else's budgets, I had a large increase in data processing costs. One thing that I don't know if any of you are aware, but the state of Wisconsin actually provides the court system with their computers and their printers. So the only equipment that the county has is our video conferencing equipment, the NovaTime, Springbrook, and our phone system. But the computers, the software that our department operates on, and our printers are all provided by the state of Wisconsin. So the increase in data processing costs, I think, are because of some of the upgrades that are going on.
It was the second courtroom. It's the depreciation for that.
We replaced the courtroom equipment last year. Then the other thing is, as I was going through preparing my budget for this year, one of the things that we had noticed, and I had called Sarah in a panic, is if you look at it would be the health insurance costs on page 3 of 4, a quarter of a way down the page. In 2014, our office had $63,047 in health insurance. In 2015, only $52,800 was adopted. We believe that when the numbers were ported from the spreadsheet that Deb gives us, at that time Molly was including the numbers from the spreadsheet that Deb gave us into the individual budgets. The health insurance column and the HSA column were not added together. So my budget was shorted
It's
approximately
about that amount.
$12,000. The amount that I'm off in my budget, I was able to absorb the data processing costs, but the health insurance costs that I was shorted last year, or I should say this year, is what I'm going to be over in 2016.
Questions?
Everett? Don't thank me. Thank the DA and the defense attorney and the judge.
It'd be fun sitting in that jury box, yeah.
Are there any questions about the amount that she said there?
Thank you.
We're down to debt service and capital projects.
Pretty basic. We have no control over this. This is the amount that we have to pay in principal and interest on the bonding that we did several years ago for the towers. It's just a scheduled increase in that debt payment. And I think we have one more year of a slight increase, and then it starts decreasing for the rest of the life of the bond, or however you want to say that. So it did go up 10,000. Our payment went up 10,000.
Questions? Board of Fives.
Thank you. The libraries are different, I think, than anyone else you've had because the libraries are not county department. They are departments of their respective city, village, townships. And so the budget request is formulated based on what those, the city of Watoma, the villages, the townships, what they are funding their libraries, and it's a calculation that says if they're funding this much, then the county, it's an equivalent amount for the county population. The request was sent to the Library Services Committee. They did cut that down a bit from what was requested, but there is an increase, a fairly substantial increase for the libraries in the county, and we hope you will fund that. Are there any questions?
Pardon?
The library services desk, how this number changed?
I got it resolved.
Oh, okay.
Yeah, we talked during the break.
Okay.
Yeah. And I believe you had come in at 11%, and then the committee asked you to
Cut it down.
cut it down to 6%.
Yeah. Yes.
Have any questions?
Thank you.
All right, we are down to EMS. I think I have to go home again.
Brian probably wants to go home too.
I think I have to go
Brian
home.
wants to go home too.
Well, we felt pretty good about the budget process early on in the process, and had really sharpened our pencils, worked with the entire team to bring it to committee, holding the line on spending. The issue was that didn't fund any vehicle replacement, which we were a little disappointed about. But then as we moved forward in the process, after it had cleared committee, we found that there was an error in the previous year's budgeting process, which had omitted about $80,000 worth of insurance expenses. And we also absorbed a little more in indirect costs than we had anticipated. So it came into committee looking like it was going to be pretty good, and a lot of work with Sarah over the past few weeks, and we found some areas where there were some errors. So if they were my errors, I'd own up to them. Actually,
Yeah.
in this case,
Yeah.
I think I'm actually
You're safe. Yeah,
exonerated.
I just
yeah.
want to point out, this would have been in the preparation of the 2015 budget. So Brian was not here, so that would have been the consultant and the former deputy director at the time. So, yeah, so Brian didn't have anything to do with that.
And neither did Sarah.
And neither did
Right.
Sarah. Correct. That is correct.
So, do we have a solution for this, Deb? Or we just have to,
Well, it's a little complicated in that the levy for EMS does not count towards the levy limit. So if the money that you would apply to those indirect costs actually is a good thing on the levy limit side, because it just gives you that much more of a buffer. So, you know, you can look at it as a really bad thing, or you can look at it as maybe it's not such a bad thing. The indirect costs, EMS is actually the only department that actually refunds the county for indirect costs, because they are set up they were set up as a proprietary business. So Sarah called Mike and Konechny at Schenck and said, okay, so do we keep them in their own separate fund or not? And they recommended that we keep them in their own separate fund. And then the second question was indirect costs. Do we keep billing those to them and they recommend that we do keep billing that to them because it actually helps the county on the levy limit side because they're funding some expenses that the rest of us are absorbing. So indirect costs are things like my time, Ruth's time, county clerk's time, all those infrastructure support systems. So, you can look at it as a bad thing, but it doesn't necessarily have to be a bad thing.
And the indirect costs are beneficial to some of the other departments because they're able to recoup those costs. Unfortunately, in the current healthcare system and healthcare reimbursement, having additional costs don't do EMS any good directly. So as part of the bigger picture, it looks like we may help the county out a little bit that way. As a department, it definitely doesn't help us at all.
It looks bad on their side. And the reason nobody caught it last year is because they came in with a 0 increase, I believe, for 2015. Well, what they did is they increased the indirect cost, but then they failed to budget anything for workers' comp. So that's what happened there. That's why they were able to absorb that, and nobody caught it.
And what Deb's referring to on the revenue side for the rest of the county, it shows up in our non-departmental budget that I have up on the screen here, the indirect cost for EMS. This is the revenue to the general fund, the equal amount of what EMS is being charged for those
Yeah.
type services.
So it's a revenue on this side, it's an expense on EMS's side.
Any other questions for Brian?
Is the Wild Rose?
Larry?
Part of the increase is for increased costs because we've moved an ambulance to Wild Rose.
I'll let Brian explain that.
And I'm just wondered how that came about. A couple years ago, we hired a consultant, paid him like $35,000, and that wasn't one of his recommendations. His recommendation was to decrease the services here in Wautoma.
No, I think actually Fitch did recommend that we should consider having one in the Wild Rose area because of the hospital.
I don't remember that.
Yeah, it came out of the Fitch study, that it was a recommendation that the ambulances staffed in Wautoma be split between Wild Rose and Wautoma, and actually the data in their study supported that.
But didn't he also say we should decrease the services here in Wautoma?
And that's what we would be doing up there. So one of the two that are here right now would go up there.
I understand that, but I thought he also recommended that we decrease the time of ambulance service in Wautoma.
Well, in reality, that's what you would be doing then, because
You will no longer have 2 crews in Wautoma. You have 1 crew in Wautoma, so you're decreasing Wautoma by 1 ambulance and 1 crew, and that crew will go to Wild Rose instead.
Oh, I thought his recommendation was we'd have 1 ambulance or 2 ambulances during daytime hours and 1 during nighttime hours in Wautoma. That's the way I remember it.
that way.
It didn't appear in his written report that way, and obviously I wasn't here at the time, so all I've got is the written report to go on. It's a more complex issue than simply moving a truck from one location to another. One of the things we want to do is most of our 911 responses, we have a goal of from time of call until the time we're on scene of being there in 19 minutes, 59 seconds or less. Most of the outliers in our responses were lying up in the north central part of the county. So to move a truck up into Wild Rose will provide better service to those folks who were falling outside of that 19-minute, 59-second response time. The other thing is, it is a $2,700 expense budgeted for next year to accomplish that. But in discussion with the hospital in Wild Rose, which is one of the 3 hospitals we provide service to, they would be much more willing to utilize our ground transport services if we were immediately available to them rather than fly some of their higher acuity patients out by rotor wing. So obviously, we want to capture that part of the market, and to do that, we have to have a truck available in a more timely fashion to them.
So in reality, how many of those kind of calls, how many runs would that take to make up that difference?
It's, the response to that is kind of like the commercial where the gal is a beauty contest. It depends on the payer mix.
Okay.
If there are 2 commercially insured patients that we transferred out of there, that would more than offset the cost of the station for the entire year. It would take several Medicaid patients. It would take a few Medicare patients. And if they were self-insured, or what we refer to as private pay, or more commonly known as no pay,
That's why we
it may
have
take a lot.
Yeah, okay.
But we think the payer mix is adequate to certainly more than offset this cost. Much more than offset this cost. The other thing we did with our budget was we tried to be extremely realistic on the revenue side. Very conservative with our revenue estimates. We think we can do better. Yes?
Yeah, he might need it tonight.
Yeah.
Tonight, Everett.
I see you have an ambulance in Watoma and in Plainfield and also in Poisippi, and the salaries are the same for all of these? The same amount of staff people with these ambulance?
Yeah, we rotate our staff from station to station. We rotate the ambulances from station to station. So one of the things you'll see in this budget that was different than the previous years is those monies have been spread out equally amongst all of the vehicles.
Any other questions for Brian?
Thank you.
And now we have a discussion and possible action on the adjustments to proposed budgets. I have 2 down here. Highway, that we want to discuss the, and then, human services.
Yeah, they offered some things.
So Kim, it was $15,000 here, right, instead of the 10?
Why don't we start with human services, because that's really the elephant in the room, I believe. So if I were Dawn and I was sitting here and you give EMS 87,000, she's gonna think, what the heck? Am I putting words in your mouth, Dawn? So, I guess, everybody had the thing to do a 0. So, I'm just throwing that out there. I'm not telling you yes or no. I'm just saying, that you're not going to be able to use that argument with human services, right? If you're not going to treat everybody the same, okay? But maybe Sarah or Melanie would like to explain the document that's up there right now.
Sure. Sarah, and you can jump in whenever you've got the mic over there. This is just like we did last year, it just compares the 2015 levy request versus this year's levy request, and then just tells how much of an increase or decrease it is, the percentage increase or decrease it is, and then it just ranks them by both those things.
did last year, when we were about, I think, almost $700,000 over the allowable levy, was we were able to apply this debt service amount, our debt payment. The state has said we do not have to include as part of the levy limits. So that's that 852,750 that you see there. So right now, we're within that. We could apply this entire amount if you wanted to, like we did last year, to, using that debt service amount.
So to put it simply, we're about 280,000. Okay, you're okay. You have $280,000 that, on the good side. Because you can apply that 534 minus the 852, that gives you some cushion. Am I saying that right, Sarah? Okay. So you have some cushion there. So I guess it's really what you want to do. Do you want to, what's your goal? Do you want to keep the mill rate down? What's your goal?
Right now, the way it stands, if everything were approved, the mill rate would still decrease?
Our equalized value increased, so that's a good thing. And yes, it would, even though we're up at this point almost 50,000 over last year, the mill rate goes down because of those equalized values increasing.
Is your calculation of the 2-cent decrease, did that, because the 47,000 more was 50-some thousand before you made those couple of changes? So is the 2-cent decrease based on?
It's still 2 cents. It's just, I think these spending numbers here
Okay.
have gone.
Okay, all right. So that includes everything that's been requested. The big one out there, though, is Human Services, that because they applied the 271,000 to their designated fund. They didn't put any of it on the levy at all.
Missy, did we make the change to your budget yet?
So you've got, library going up, and you've got EMS going up, and you've got human services going up, or the potential for them to go up quite a bit. So that's really those are the decisions you need to make.
All right, and we have to do, we haven't done, we have to decide on the $6,000 for highway as well. I understand the expense in human services, but I don't think we can absorb all of that. I just don't think it's fair to the other committees, because they held their budgets where we asked them to, and I understand EMS, but that was a mistake that was made last year, and we're correcting it, right? So, I don't think we can allow human services to go up as much as they have. I think they're gonna have to take.
In our discussion that we had at the committee meeting, that $271,000, we thought we could split that and take half of it out, considering that one child that gives us a problem. And so we'd be around just a shade under $136,000. I don't know if you would be happy with that or not, but that was part of it.
We found that to be our best option, as we thought anyway there.
Are there any other comments?
Are you saying that it's still gonna go up 271,000, but they're only taking?
No.
They would apply half in their designated fund, and then half would be added to
It's
the
still
levy.
going up.
No.
Expenses.
Yes, it's still going up. Right, I understand that, but it's still going up.
Yes.
Yeah.
And if they got hit with a big, unforeseeable, unpredictable incident, they'd have to come back to the county board for help. Is that?
Well, they have.
I understand
bit
they
in
have
there.
some money, but all it takes is 2 or 3 cases. If somebody comes in here and has a child or an adult or something, we're responsible for that. And if they ain't got the money, they would have to come to the county board?
Ultimately, the county board is responsible.
Okay. Yeah, I understand.
When they've had something come up.
Right,
And it just, yeah, yeah.
last resort.
One comment, at least the sheriff that we have now doesn't keep coming back asking for money, more money, like it had been in the past. 216 isn't over.
It ain't over till it's over, Russ.
I'm just letting him know that we're, I'm just letting him know not to come back and ask.
He'll change his mind now that he sees we're giving him the services. So, what do we want to do here?
I would vote for that half, 50%.
Option two.
Option two.
Has the home committee looked at all the things, you know, that there is nothing that could be cut? Dennis, or anything that you guys do, or Russ?
I think we have.
Looked it over fairly close, and we're,
You have to understand that all you're doing is compounding the issue for another year. So I believe that maybe giving them some money, that isn't the worst thing, but you're gonna have to give some directives that they're gonna have to start really looking at this, because at some point, you are gonna hit the road, you know, it's gonna stop.
you're gonna have to cut services. Yeah.
Might just have more problems down the road, though.
So just to clarify, you're talking about changing those revenues right now?
That was in option 4 and 5, you'll see.
Okay.
That we did bring, after the, executive committee meeting, or I can't remember if it was after or before, but, we did look at it again really closely to see, okay, is there anything else we can do right now? And that was one thing we thought would be reasonably, if all goes the way it is currently. I just mentioned that before.
So how would that impact your bottom line then?
We can change this right here, if you tell me to. Page 4, we increased, CCS there under public charges for services at 500,000. We made that 525. See where I'm talking about?
I don't have the page numbers.
Okay, it's,
What's the account?
public charges.
Oh, here.
Page 127?
Yes. We increased that to 25,000. And then page 12, which is, page before it is Community Support Program, CSP. And that
There you go. There you go.
150,000 requested for contracted, we took that down to 120. That would buy us 55,000. So we'd be getting closer and closer to not taking money out of the designated fund, which is the ultimate goal.
In this scenario, Dawn, would that be still including that half in the fund balance applied, as well as those two changes, or was it one or the other?
So would the half go down too?
Yeah, would the half go down then? Right, because now they're at 80,759. Do you see that on the bottom? So the levy request is 80,759 does that mean you want the 135 in the fund balance applied to go down accordingly, so that that number is like 80,000 and then the bottom line is 135, or is this what you want? Mm-hmm. You see what we're saying?
Yes.
So, yeah, so what's your pleasure?
So the bottom line is 80,759. So if we split it, then it's 40,000. What? Say that again.
It would go up another 27,500 would be the levy increase, but because the fund balance would go down by that 27.5 if you split the 55,000 versus the 40,000.
135,760, which is what it is right now, you know, the half of what they were anticipating, and then subtracting 25,000? Is that what you're talking about?
Right, like, because if they reduced their expenses by another 55,000, if you took that $55,000 and you divided it in half,
Okay.
then
Now,
it would be that.
you're splitting it, yeah, so now go down and see what they did for the levy. Okay, so it's close, okay.
So we'll be splitting the 105. So that
No, you're splitting the revenue, the increase in revenue and the decrease in expenses, that's what you're splitting.
So instead of having 271 come out of the full fund, that number got reduced by the $55,000 that Dawn just gave you.
Okay.
And then you divide that number by 2, and that's how you get this 105 and 110.
Right.
If that's what you choose.
And is that, and is that what you want to do?
So scenario 5 is that 216 divided by 2. One goes in the tax levy. No.
I don't have that sheet on the
Uh, the thing she listed was,
You're talking about option 5 where the 216, the whole amount goes to the designated fund, or the designated fund.
no, I'm just saying, why can't you split the 216 and have half of that go to, just like we were doing in number 2, but just because you're
And that's
applying
kind of what
those.
we tried to do here.
Yeah, I know, but,
Instead of 110 and 105, we
Right.
tried to do 108.
right.
My math here was not,
Right.
make it exactly half.
Forgive yourself, you went to Plainfield.
I do have a college degree.
I had to get that in there, otherwise you'd get me later, so.
So that scenario brings us up to having to apply this amount of the debt service, and that would increase our mill rate by 2 to
Now it's
2 to
going
3
up
cents.
2 cents, okay.
But if you apply the whole 800,000, now you look at that.
It was 852, 750. I guess I'd have to, we can't just change that number. I'd have to add it to this.
Okay. So probably another couple cents, huh?
Well, no, because if you're applying, oh,
What do you wanna do with like the library? Any recommendations on that?
say it's gonna come out of debt service, where exactly is this money gonna come from?
Well, it's not coming out of anything, it just,
It doesn't count towards the levy limit.
it's kind of sort of like EMS or the library. It doesn't count towards your levy.
You pay every penny of it, but it doesn't count towards the levy limit.
I know, I'm not worried about levy limits, where is it money gonna come from?
That's the money that's already budgeted to pay down our debt for the bond.
So will we pay less off on the bond then?
No, we're still paying the same amount, we're just calculating it different for the levy purpose. Because you can either include it as part of your levy limit, or you can take it out of that calculation.
That's not what I'm concerned about. I'm just concerned about where is the money gonna come from for the debt? Do we have to borrow it, or?
No.
It's already in the budget, it's budgeted for, it's just whether or not you count it in as part of your levy limit or not. It's still there, it's the same amount we're requesting.
I'm not worried about that part of it. Where are we gonna get the money to pay it?
Taxes.
General fund.
It's in there, it's in the budget. There's a debt service sheet you have. That amount is not changing. It's just how you calculate it for levy limit purposes is what's changing, is what you're
But
talking about.
last year, we had money left over in our bonding that we used.
That money is all gone.
I know, where are we gonna get it from now, if it's not from the bonding?
No, now we're paying it back. We have so much set aside in the general fund every year to pay it back.
I know that. But
I
where,
understand your question.
I know you don't. Where are we getting the money to make up the difference in the budget?
From the tax levy.
The tax levy. It's all there. So if you look at the requested levy amount 2016, that 852,000 is in that number.
It's in the levy.
We still need to talk about what we want to do about deers.
You gotta pick them up, okay. But is it,
Well, I
are you
think we're
adding more to it? Because now, I mean, you're already going up 11 cents. You just gotta remember that, okay? And that's what
Actually,
people
2
notice.
cents, the 11
But
was
if you went to
we
the
did the whole,
852,
yeah.
yeah.
Then if you did that, then, so Brian's expenses would go up by 6,000 and his revenues would go up by 1. So it's gonna change that.
By 5,000.
I think we have to do that. I think we have to put that in Brian's budget.
Yeah. Tourism is our number 2 industry, for gosh sake. I've got 9 lakes in my township. When they find that deer laying on their lawn, I'm the one to call.
Charge his township twice as much as everybody else. You got more. You can have more. Make a note of that, Brian.
That you're gonna have to do another count for, aren't you?
How many townships didn't sign up, Brian? Or
Out of the
was it
18, I've only got 4 responses so far. 3 were yeses and 1 no. I believe, Waukegan, Springville, and Tacoma are in Hancock's already responded.
Yeah, I'll put that in.
Springwater will be in, if I have to pay it myself. Write that down, somebody.
Unless the majority don't want to pick them up.
Pick up our own.
No, I mean the majority of you people sitting up there right now making a decision about the number.
I hate to see them on the highway. I'd rather have them seen picked up. I live on the main highway, so they're gonna get picked up anyway, but I think a township should.
The question really isn't whether they're gonna pick them up or not. The question is, are you giving them additional money to do it?
Right. Right,
That's really
that
what the
way-
question
That's
is.
the way I think I should have money. And you can rebuild the township, is that what you're planning to do? After, when you pick them up, are you gonna rebuild the townships?
She wants to know if you're going to, when you pick them up, well, you're not gonna be picking them up.
Oh, it's
Contracted.
Whoever does.
But you will build the townships.
The intent was, the DNR has a number of how many were picked up in West Shore County last year, what the dollar amount was. So how would we arrive at
levy.
So it's a 3 cent, so it's a 5 cent turnaround? Or is it 3 cents, so it's a 1 cent increase?
It's 2 cents over what was the mill rate was this year. It would be 2 cents more than that.
So,
Equalized value went up, so that's what's saving you a little bit.
Deciding about, have we decided the human services part of it, or do we still have to have more discussion on that?
I think we decided. Sounds like to me.
Right now, what we have is, human services applying this amount of their fund balance on the revenue side, and,
Could you speak up, please?
Sure. Right now, what we have is human services applying this much of their fund balance, their unreserved, undesignated fund, and they upped some revenues and decreased some expenses, and they are now up 105,759 over 2015's tax levy request, and that's the total.
Do we need to vote on this?
Yes.
I mean, are we voting on all of them, or just this one?
You would need to vote on all of them, but you could do it
Individually?
individually or together at the end, or if you wanna put together a package, or you can use that separately. You wanna do the budget separately, or?
So we've got, on highway, if you wanted to do it all together, I'll just recap. Highway's, up 5,000. We increased it 5,000 overall, 6,000 on the expense, 1,000 in revenue, so 5,000 overall. Human services, we talked about. Child support, we tweaked a little bit. We increased their revenues there, so that lowered their tax levy a little bit, 5,000 more dollars. And circuit court, we took this off, and if I'm missing something, let me know. Took that, and then we took off overtime. So that's their new total. So they'd be up.
To reduce the expenses that are $750 for the light bills.
Right. And overall, it would be looking like that. So you're okay
clarification now. We're voting that all the budgets that were presented and the changes or additions that were made, so that's all included? Yes. Okay.
And that's what then printed,
Yep.
come to public hearing in November.
All right, we have a motion and a second. Do we have questions? We need a roll call vote on this.
So
Pat's got a question.
this, according to that, it's gonna increase, like it says there, 2% increase mill rate. With all these proposals, okay.
Ready for the roll? We ready?
Yes.
Okay. Mr. Wadle?
Yes.
Mr. Rothermel?
Yes.
Mr. Kirschner?
Yes.
Mrs. Krantz?
Yes.
Mr. Heisey?
Yes.
Mr. Tim?
Yes.
Mr. Eckstein?
Yes.
Mr. Weddy?
Yes.
Mrs. Coletta?
Yes.
Mr. King?
Yes.
And ayes, one absent. Passes.
This is what we bring in November. Remember that, I will not be here. Mark, it will be in very capable hands in November.
I think he's giving you a dirty look.
I think he is. Next, we're gonna do discussion and thank you all for the work you did on your budgets. We really appreciate it. Next is a discussion and possible action on Hancock EMS building.
Oh, okay.
And the handout that's coming around now is just a duplication of the slideshow that we have, which is very brief. And it also has a couple of documents on the back that just easier to see on paper than on the projector. So a little bit of background, just a refresher, I guess. EMS responds to about 2,800 calls for assistance annually. We serve Waushara County, with the exception of Aurora Township and a portion of Warren Township. But we also serve Colburn, Leola, and Richfield Townships in Adams County, and Nescoro Township, including the village of Nescoro and part of Crystal Lake Township in Marquette County. We also regularly serve 3 critical access hospitals, including Wild Rose, Berlin, and Mound View and Friendship. So we provide a lot of interfacility transfer work for those 3. We staff 4 ambulances around the clock. One of those, at least one of those, is at the critical care level. The other 3 are at the paramedic level. And currently stations in Wautoma, soon to be Wild Rose, Poisippi, and then a station on the west end that splits its time between Coloma and Plainfield. The potential for a station in Hancock was identified a few years back, reiterated by the consultant when the consultant was here and did their report. What it does is provides easy access to the western third of our county. It provides easy access to the contracted portions of Adams County, easy access to the Interstate 39, also easy access to Friendship, which is one of the hospitals that we serve. Some other advantages, the staff and ambulance would be housed together, which would equate to a reduction in response times, because currently when the ambulance is housed in Plainfield, the crew is separated physically from the ambulance, and our times over there are a little slower because of that. That also increases our exposure to liability, because it puts our personnel responding to a call for help, which may be urgent in all weather conditions, and particularly wintertime, it exposes them to the high potential for falls on their way to the ambulance and so forth. Some other advantages, it would help us to align with the recommendations of Fitch and Associates that were made in 2013. One of those was to consolidate stations in Coloma and Plainfield into a single station in Hancock. They went on to say it should be configured so that the crew and ambulance are in close proximity to each other, which this would accomplish. And talked about the establishing a response time standard of 19 minutes, 59 seconds at a 90th percentile factor for emergency 911 calls. So it would help to accomplish that at least 90% of the time in the western end of the county because of a more central location. Here you can see, and you have a hard copy of this in your handout on one of the back pages. The elevations that were proposed by the architect for this building. You can see it's not a terribly fancy looking building from the outside. It was designed with function in mind. The floor plan, very basic, very straightforward. Again, you have a hard copy of this, one of the back pages of your handout. It includes one oversized garage bay, which would allow for washing of the vehicle inside of the garage, some storage for medical supplies, a mechanical room, small kitchen, one bathroom, 2 bedrooms, and then a day room, which would also, a portion of that would function as the office area. It's important that the office area be identified on the plans because that makes us subject to a little less stringent code than when it comes time to build this. The costs associated with this, it was put out to bid. The bids were received and opened on the 23rd, I believe. Cornerstone Builders out of Hancock was the low bid at $235,086.88. You can see more of the bids were around that $300,000 mark, with one of the contractors bidding over $300,000. So we were pleasantly surprised with the low bid. It was explained by the architect at that time that that was going to be accomplished by the builder partially through panelizing the construction of the walls rather than to traditionally stick frame them on site. Additional costs that have either already been incurred or would be associated with that building. Architectural fees to date, about $7,300 have been expended. Site preparation work, over $13,000 has been expended. Architectural fees, anticipated future architectural fees of $3,000, anticipated asphalt costs of about $4,500, the construction contract at $235,000, fencing at about $8,000, which would separate the site from the highway department site. A furnishings contingency of about $4,500 because some of the furnishings would be repurposed from our west end stations now. However, appliances and so forth would have to be purchased for the new building. Site grading and seating, about $2,500. And then I put in a contingency for utilities at about $10,000. That may be a little high. Depends on what they have to do to get utilities to the building site. But that comes very close to what our architect had estimated as a total project cost of $290,000 to $300,000. My estimate comes in at about $288,429.52. That includes monies that have already been expended and monies that would be expended. I promised to keep it brief. So any questions for either Randy or myself?
Ryan, do you know offhand about how
do have some funds that were set aside. Those were recently, and I'll ask you for help on this one, Sarah. They were recently dipped into after a
We had closing entries that came in August from after we met with committees that came from the auditors and didn't realize until I went in more depth with Brian that it actually hit their designated funds. So there's actually, what they had in there is only about $45,000. And the auditors suggested not to wipe that out. So I don't really think that you have any funds, designated funds to apply towards the building.
We had about, just to make that clear, we had about 95,000 in that fund until those adjustments were made, and it took it down by about $50,000.
The money that's already been incurred, did Randy, did you pay for that out of yours, or did EMS pay for that?
EMS has absorbed those costs, and that was at the direction of the Public Safety Committee.
So really what you're asking for is the $267,000?
The balance of that to be funded, yeah. Obviously, we feel it's an important project, or I wouldn't be here. Important to the overall system function.
So I guess if I can jump in, so really what the question to you is, should we proceed with this building project? Fairly recent, just a few weeks, right? So they shouldn't change that much. But the money, the second question is, where does the money come from? And it would have to come from the general fund.
Brian, do you have any idea of how much, like, the ongoing costs of having the new station would be? Or would we save money by pulling out of those two other areas enough to, offset that? Or
It would probably be close to a wash. There'd probably be additional costs, obviously, associated with owning our own building and having to pay the utilities on that, as opposed to renting in the two locations that we currently split our time from. So those monies would obviously go to help offset the cost, but I'm sure there'd be a slight additional cost. Until the building is constructed and in operation, it's anybody's guess what that might be.
And those ongoing costs are not in their 2016 budget request, just so you know, whatever those might be. Sorry.
Do you have to get another ambulance to house over there now too, or what's?
No, we already have an ambulance on the west end of the county that shares its time between Coloma and Plainfield.
So you're gonna eliminate one of those places, or what?
Yeah, we would no longer house an ambulance out of either. It would be housed solely out of Hancock. And that's because of the more central location.
We looked through different sources. We tried Cleary Builders or Pole Barn, and they felt in the end that they couldn't build any cheaper and were probably a better structure than we did. We tried prefab, but access, as far as handicap access, is held to all buildings as far as for us. So the prefab would not design a building or build anything that would be handicapped. So that was, outcome wasn't cheap either. So we've come back to the first option that we started. And so we feel that this is a pretty good price instead of what we've been looking at. It started in 2012, so.
Talking about this for a long time, so.
We had gone right away, we'd avoided the prevailing wage increase, and that's what's really driving the price up on this stuff.
You service 3 townships in Adams County, don't you, Brian?
Yes.
Oasis and Colburn and Richfield, right?
They're-
Or Leola, I
Yeah,
should say.
Leola.
Yeah, Leola, pardon.
Yep, they're listed out in your handout there.
Oasis, I can understand.
Any other questions?
What do we have in the general fund?
$7.3 this is too small of a project. I would not suggest bonding. You have 7.3 million in undesignated funds. I just would not suggest. By the time you go through the bonding process, the fees you would pay, you pay the same fee whether it's a $8 million project or a $100,000, yeah.
Are there any long-range plans for doing something on the east end?
That's one of the things that's been discussed several times in committee since I've been here. And one of the advantages to the plan that we have for this building is it's easily duplicated anywhere else. So depending upon what the system demand is in the east end of the county, once you identified the ideal location and secured that property, a very similar plan would just be put into place there.
I know I'm a very cynical person, but the fact that they delayed that to 2017 tells me they're not serious about that. There's 2 more elections between now and then, so I wouldn't hold my breath on that one.
And the other part of that is that our architect, who acts as a consultant, obviously, he told us that since this project was already in the works, that prevailing wage may apply to that, even if prevailing wage were to go away in 2017. So the current project may not be exempted even when prevailing wage goes away.
Just a comment, the ambulance service in Poisippi is located in one station. It does not rotate between one end of the county to the other end of the county. It's located in the same place. The people use the same facilities for their, sleeping and staying. I think we have great ambulance service in Poisippi, and I think you guys on the west end of the county deserve the same as we have.
I would just like to say, though, Russ, I don't think that is the best situation.
Don't either.
Because the apartment,
Oh, that part I'm referring to the ambulance the part where the
The-
ambulance is stored. Maybe not where the people are staying,
well,
but
I think there's options. I know your goal is to keep it on the east end, and I don't think that that's an issue. Okay?
No, he's just saying, what I think he said was,
Right.
he's happy with the service he gets, and he would like to see the west end people get the
Right.
same service.
Yep, I'm not saying the facilities are the best or that, but it's located in a place real close to 49, and, either direction, if you go to the south or to the north or east or west, it's located real close to everybody.
Brian gets that.
But one of the negatives there is that they have to travel from the bank building to the ambulance
That's
garage
it.
in the wintertime.
Right.
It's a
Dangerous.
dangerous situation too.
I think they're looking into that.
Yeah,
They're
we
looking
talked
into that.
about that a lot in
Yep.
committee.
You have the same thing in Plainfield, don't they, Ruth? They stay across the street? Right.
We talked about this a few years ago already by trying to centralize it. I really think it's a great idea to centralize it in the western part of the county as well. That way, everybody there has equal service. At the present time, if the ambulance is in Plainfield and someone in Coloma needs it, it takes that much longer to get there. Obviously, if you're in Plainfield and the ambulance is there, it's there. But I really think it's a good idea to go ahead with this project, and I'd like to make a motion.
Do you wanna separate the motions, one to proceed, the second piece of it, how it gets paid for?
I will include it being paid for on designated funds.
Undesignated funds.
Undesignated funds.
Okay, a motion by Weddy, second by Kirschner. Are there any more questions or comments? All right, we'll do a roll call vote.
Mr. Rothermel.
Aye.
Mr. Kirschner.
Yes.
Mrs. Krantz.
Yes.
Mr. Heisey.
Yes.
Mr. Tim.
Yes?
Mr. Eckstein.
Yes.
Mr. Weddy.
Yes.
Mrs. Claudia.
Yes.
Mr. King.
Yes.
Mr. Wadel.
Yes.
10 ayes, 1 absent.
Thank you.
Okay, we have board suggestions.
we get sick, guess who we're gonna blame?
Yeah.
I think that's the plastic bag over his head.
We all need cough drops now. We all need cough drops now.
Should've told me to stop at the corner. Good thing I didn't hear. I would've said, hey, I'll have another one.
I'm doing,
Oh, Lord,
my,
love of
my
God.
daughter, so our first child,
She can shred them up. I don't need them.
didn't sleep much more than like an hour.
I'm sleeping in the easy chair by now.
Right here?
Wife says, wake up. I wanna watch news. You missed that a half hour ago.
Okay. Yep, yep, sounds good. Yep. Oh, goodness.
Shut this down. Taking it out of the general fund.
They had enough.
One of these days, that general fund is gonna be empty. I guess.
It's all over here.
Be dead by then, so what?
Like I told you,
They're gonna
Jerry,
be
I
gone.
won't be here.
Yeah, you.
That'll be your problem.
I'll run if nobody runs against me.
No, you'll be on here for life.
No, I don't know about life. There's times now when I wonder why I get myself involved with all this stuff. Gullible, I guess.